Good morning to all. We have already seen previous video ventricles and CSF fluid. There we discussed CSF fluid protect the brain and the spinal cord, and it is covering of the ventricles cavity like that we discussed earlier. Today we are going to discuss the in-depth of the cerebrospinal fluid. Cerebrospinal fluid is a clear and colorless liquid. It is not a simple ultrafiltration of the blood product, but it is actively secreted by the choroid plexus. Keep in mind, it is actively secreted in the choroid plexus. It is the epithelial cells having a characteristics of transporting and secretory cells. In that choroid plexus, there is the apical surface and that having the microphyllae, and there the basal surface exhibit the interdigitation and foldings, many foldings. See here in the choroid plexus, we already know the apical surface having the microvilli. Here it is given clearly. Next to that, it has a small projection that contains the choroidal capillaries. Through this, it filters the blood. Next, characterization of the CSF fluid. It produces at the rate of 0.35 to 0.37 ml per minute it secreted. For example, per day it produces 600 to 700 ml. Entire reservoir in an adult is 90 to 150 ml it reserves, of which 75 ml is intracranial, 25 ml is ventricles. In newborn babies, it is 40 to 60 ml, and this amount is completely replaced several times. It approximately 4 times. Formation rates depends upon the osmotic pressure and hydrostatic pressure of the blood and variations in the venous pressures. It is independent of CSF pressures. Carbonic anhydrates involved in the production of CSF formation. Carbonic anhydrase is the main part for the production of CSF. Where it is produced, we know choroid plexus. Next one is sources. It is a tight junction at the apical ends of the choroid epithelium or permeable to the small molecules. The fenestrated capillaries lie beneath the epithelial cells. Hence, the sources of CSF are choroid plexus and ependymal lining of the ventricles, extracellular fluid from the brain parenchyma cells. The contribution of each is unclear. Main bulk produced in lateral ventricles. Then anterior choroid artery branch of ICA and posterior choroid arteries is a branch of PCA. Arterial choroid artery is a branch of ICA and posterior choroid arteries is the branch of PCA. Next one is function of CSF fluid. Most important function is it is a mechanical strength. And next one is serving as a water jacket for the brain and the spinal cord, and it helps support the weight of the brain and Cushing's effect, and it is a lubricant between the brain and the cranium, act to dissipate the force of blow to the head. Next, it produces the space compensating mechanism for regulating the contents of the cranium and helps in keeping the ICP relatively constant in nature, and it maintains the homeostasis, maintain a constant external milieu for the brain in equilibrium with the ECF of the brain. We all know CSF fluid is a clear colorless liquid. It is a liquid nature, and which compare with the plasma and CSF, what are the different ranges in that? It has the sodium, potassium, magnesium, calcium, chloride, bicarbonates, glucose, amino acid, pH, osmolarity range, and protein and specific gravity. These is vary from the plasma to CSF fluid. Here the protein level is plasma in 7000, only CSF contains 28. Like that, every molecular composition is vary with the plasma. For exam purpose, you have to memorize the composition of the CSF fluid. We know the CSF fluid is filled in the cavities of the ventricles and also the brains and spinal cord. Here the pink color indicates the circulation of the CSF fluid. Next we'll move through circulation of the CSF fluid in the subarachnoid spaces. Here the blue line indicates the circulation ways of the CSF. In this video, we are going to see a formation, volume, circulation and absorption of the cerebrospinal fluid. How it is formed, what the volume it is secreted and how it is circulated and where it is reabsorbed again. Imagine whole 100% brain. Here the 80% brain is filled with brain itself and 10% is blood and another 10% is CSF fluid. CSF fluid maintains the weight for the brain. Imagine our CSF fluid is secreted already in the choroid plexus. After that, where it is goes? First step is, as it is produced, it passes from the lateral ventricles through the intraventricular formia to the enter into the third ventricle. From the third ventricle, it passes through the fourth ventricles and from here it passes into the subarachnoid space via the midline foramen or the two lateral formia and followed by it passes around the spinal cord fully inferiorly and envelop the brain superiorly. Inferiorly it covers the spinal cord and superior means upper side it covers the full brain surrounded and like enveloped. Then the fluid enters into the bloodstream by passing into the arachnoid villi and diffuses through their walls. And the arachnoid villi project into the superior sagittal venous sinus. Next is how the arachnoid villi looks like. It looks like a capillary projections and outside the epithelial layer, the apical membrane. From this projection, it has the subarachnoid space itself for the storage of CSF fluid. After the full circulation of the CSF fluid, it has to reabsorb. How it is reabsorbed? Subarachnoid space and through arachnoid villi and granulation through venous blood. This is the process way. After this process, there is a protrusion of the arachnoid matter through perforations in the dura into the lumina of the venous sinus. In intracranial superior sagittal sinus, 85 to 90% absorbed, and spinal cord, it is the dural sinusoids or the dorsal nerve roots, it absorbs 15% of the CSF fluid. Here the high velocity of the blood flow through the fixed diameter of the sinuses and the low intraluminal pressure that develops at the circumferences of the sinus wall where the arachnoid villi enter and causes the suction, it reabsorbs, suction pump action. Its circulation continues over a wide range of the postural pressures. It continued with the postural pressure, thereby it simultaneously reabsorbs by the suction pump action. Next we will see the summary for the production, circulation and reabsorption process. Site of formation in the sense choroid plexus of the lateral ventricle. From the lateral ventricle, the intraventricular formia is there. From this to third ventricles, that is the cerebral aqueduct. From that it passes through the fourth ventricle. From in fourth ventricle there is the lateral formia, median formia and lateral formia. Next to that median formia, it goes to the subarachnoid spaces. It goes to the inferiorly in the sense spinal cord. From that subarachnoid spaces, it goes to the superior also. It surrounds the brain. From the passage of the subarachnoid space to the superior only, it reabsorbed. There it is, the absorbed arrow mark is there. So it is reabsorbed into the choroid plexus by the process of pump suction action. Here the 80 to 90% reabsorbed and the inferior portion it reabsorbs 15% of the CSF fluid. This is the outline of the CSF fluid. This chart is important for you to understand easily for the formation, circulation and reabsorption of the CSF fluid. This is the hydrocephalus condition. It is the clinical condition. I see here then first children head, it is the green color indicating the ventricle space, and second it turns to the swelling, it enlarged because of the CSF fluid enlargement. It causes the hydrocephalus. See here the original picture of the child is very big headed children. This is because of uncontrolled production of the CSF fluid in the brain. It causes the enlargement of the brain. It is the clinical syndrome. From here we finish this portion. For your extra understanding and extra knowledge for you, I am adding the method for determination of the CSF formation rate and the resistance for the absorption of the CSF fluid. First one is volume injection or withdrawal method. Here the ventricular or spinal subarachnoid catheter for injection or the withdrawal of the CSF fluid, and for measurement of the accompanying CSF pressure changes. Here we measuring the pressure changes. Next method is monometric infusion. Here the monometric infusion device are there which is inserted into the spinal or subarachnoid spaces, move CSF into the SAS. CSF pressure measured at the same site of infusion. Each steady state of the CSF pressure is paired with its associated V1 values. Next method is ventricular-cisternal perfusion. It is the cannula placed in one or both lateral ventricles and in the cisterna magna. Labeled mock CSF into the ventricle and the labeled mock plus native CSF collected from the cisternal cannula, and volume of the CSF fluid is determined here. This determination part is not important to you guys. With this I finish. If you have any doubt, please comment me. Today's question was the circulation, formation and reabsorption process flow chart for the CSF fluid. Thank you for patient listening.